We are going to talk about the lower back. Some people they have problems in the lower back because they spend so much time sitting down. Some people because they do a lot of exercise like Mark does. And normally they think that the problem should be concentrated on the lower back. And most of the times the lower back is where you feel the pain, but the problem comes from the hip flexors and from the glutes, that they work together. In order to unlock the lower back, you need to release the hip flexors and the glutes. They are super deep muscles, but it's really effective. And we're going to do that with Mark. How you feel when you feel that the glutes and the hip flexors are getting better?
Everything moves really freely, so rather than running quite stiff, it just feels very natural.
The biggest problem that he will feel if his glutes and his hip flexors are tight, he will feel the lower back like it's locked. And we are going to unlock this area to make sure that everything is freer. I'm first doing a bit of a palpation how the glutes are feeling and releasing a bit first like this manually, and then I will go a bit harder with my elbows, because I must admit that the glutes are made of many different muscles. Gluteus maximus, minimus, medius, piriformis. In order to go to the really trigger points, I need to go deeper. And in order to do that, the best way is with my elbows. His issue is exactly here, in the border of the glutes, you know, where all the joints are. So basically, these trigger points are still super, super tight. What I do first, I warm up the area. Can you feel it? Mm-hmm. I will be here approximately like 30 seconds. And what we do is releasing it. The lower that you go, the more painful it is. Yeah. How does it feel? It's a good one?
Yeah.
These trigger points can be very intense, but they release completely the glutes. Let's do a second round. Yeah, okay. This is a really good one. Come on, let's go.
Whoa.
It's too much? Would you like a bit less?
No, that was just on the limit.
It's really very intense. It's absolutely intense. It feels like all of the tension is disappearing. I will start releasing the trigger points as well on the feet. The most important thing is the glutes and the hip flexors. But because everything is connected as well, you need to release the ITB and the hamstrings. That will help as well the glutes to be a bit freer as well. It's good as well to work on the hamstrings, but everything is connected. We do a bit of the ITB. We don't go too hard. As well, you can work on the quadratus lumborum a bit. It's a very easy muscle to release as well, because he can handle, I go quite deep. With other people, if they cannot handle the really elbow pressure, I will do less intense. You can do as well a bit, you know, on the feet, because feet as well are so important. Here? Okay. Okay. It's a bit complicated to reach these areas because they are very deep. How does it feel?
Definitely feels significantly better.
Of course, now it will be quite tender. Now we are going to do the second part in order to unlock the lower back, this area. I'm going to release the hip flexors. In this circumference, we have all of our organs. We have the pancreas, the stomach, intestines. In this area is only the muscles, hip flexors, iliopsoas and the psoas. The psoas is the deepest muscle in the whole body. Here is the iliopsoas. You ask Mark to take a deep breath, and I push down when he exhales, okay? You can do this with your hand, or with your elbow. If this is bearable, manageable,
Yep.
it's not too. Can you feel it?
This is fine.
Can you? I cannot go harder.
Yeah.
It helps a lot. And the second part, it will be the psoas. It's like a little wire, and it can be confused by a tendon. It's very difficult to. It will be here, and basically I will just take his leg up, mind the right spot, and it's okay. It's not too bad.
It's fine.
Releasing the hip flexors is like opening a book. When they are tight, you are like this, and when they are freer, you open the book and you feel taller. The psoas is a very important muscle. It keeps your lower back and your upper back together. Without that muscle, if it's not working, you will collapse.